Good morning, everyone. Again, I am with you with the next session of the chapter. That is the next session of why do we fall ill. This was the chapter that we were doing. And we had already discussed about the disease, about health, and what are the different kind of diseases. Infectious, non-infectious, acute and chronic. And we already had discussed about the infectious diseases in detail, that how these diseases spread from one infected person to healthy person. Secondly, what are the means of spread? But if someone is suffering from disease, that person has to think about the treatment. So treatment is very important, that what kind of treatment a patient should take if he or she is suffering from any disease. So the topic is principles of treatment. What kind of treatment a patient should take? So there are two ways of treatment. The first one is to reduce the effect. To reduce the effect of disease. If someone is suffering from communicable disease, then there must be some effects of that disease, like fever is due to disease, like pain is due to disease. So these are the symptoms. So when we will take medicine, by keep this thing in mind that we have to reduce the symptom of that disease. So that kind is known as symptoms directed treatment. This is in the case of corona, because as you know, there is no vaccine, no permanent treatment for the corona is till now. So that's why what kind of treatment doctors are giving to the patient. If the person who is suffering from corona, if that person is having any problem in taking breath, or any kind of fever or any kind of pain, so doctor is treating that patient on the basis of their symptom. Doctor is giving medicines to reduce the symptoms of the disease. So this is the first way to reduce the effect of diseases, and it is symptoms directed treatment. But the second one, for those diseases which have a particular medicine against that particular causative organism, that is to kill the cause of the disease. What is the cause of disease? In the case of infectious diseases, that infectious agent is the main cause of disease. We had discussed about it. So to kill the cause of the disease, and in this kind of treatment we use the particular medicine which is used to kill the pathogen. So there are two kind of treatment. The first one, symptoms directed treatment, and the second one, pathogen directed treatment. In the first one we reduce the symptoms of the disease, and in second one we take the medicine to kill the pathogen, to kill the microorganism which is responsible for the disease. Now the question is that how can we kill the particular microorganism? Basically there are some chemicals known as antibiotics. These are the chemicals which are secreted by some useful microorganism, and these may be fungi or these may be bacteria. So these are the chemicals secreted by microorganisms that kill or hinder. Hinder means a kind of interruption, a kind of you can say they reduce or they stop the growth, that kill or hinder the growth of the harmful microorganism. So we can say useful microorganisms are used against the harmful microorganism. But remember the one thing, these are the chemicals which are secreted by those organisms. We are not using that organisms. We are not using that particular fungi, that particular bacteria. No. We are using the chemicals which are secreted by those microorganisms, and these chemicals are used against the harmful microorganism. So these chemicals are known as antibiotics. You usually heard about the antibiotics because when someone is suffering from any bacterial disease, then antibiotic is to be taken by that particular person, because antibiotics are mainly effective or antibiotics are taken against the bacterial infection. If someone is having any bacterial infection, then doctor prescribed antibiotic to kill that particular organisms. So when someone is having any kind of disease, then we have to target on the treatment. But we should know that during the treatment, a multiple kind of problems we have to face. A patient has to face multiple kind of problems. So it is better to prevent than to cure. Basically, as I have written here, principles of prevention. Now prevention is the word, or prevention is the method which we have to adopt to avoid the disease. And curing is to be done if we are suffering from the disease. So prevention before the disease, so that we will not suffer from the disease, and curing if we had suffered from the disease, then we have to cure, we have to work against that. So principle of prevention, I had written here, prevention is better than cure. Why prevention is better than cure? There are three reasons why prevention is better than cure. Patient may never recover completely. It may be that if someone is suffering from any kind of communicable disease, and that disease may be of that type, that patient will never recover completely. So any kind of bad effect will remain in the body of the patient, so that the patient may never recover completely. Secondly, likely to be bedridden for some time, even the patient is taking treatment. Even treatment is given to the patient, but the patient can be bedridden for maybe some time or maybe long time. So again, it creates a lot of problem that a person is bedridden. It will be good for 2 or 3 days, but if more than 2 or 3 days, it will be very much, you can say, disappointing that we are on the bed and everyone is going here and there. So that's why person does not feel good. Serve as a source for infectious diseases. If a person is suffering from infectious disease, so that particular person can also transfer that disease to the different person. That means that patient become a source to transfer the disease to the healthy person. Like in the case of corona, why a corona patient is to be isolated from the other? Why that patient has to be isolated? Only because of one reason, that patient serve as a source for that corona disease. So basically, other than these three, a lot of problems will have to be faced by the patient if patient is suffering from any kind of disease. So that's why we can say that prevention is better than cure, because while we are curing, we have to face a lot of problems. So why not we should adopt the method of prevention. Prevention is better than cure. So after that, I will discuss the second session of that chapter. I hope you can easily understand this particular area, and I already told you that you should go through the NCERT also while you are listening about the videos, while you are reading the any kind of study material. So NCERT is must. Hope you understand. Have a nice day. Goodbye.